affect, services in the province. You can understand a hospital as big as
Mhm.
Maxeke and the kind of services that an academic hospital provides, especially as part of the response to COVID-19 in the province. It creates a huge gap for us as a Gauteng public health system. But of course, we are hoping that people are watching the news and word is spreading that the hospital is temporarily closed and they should seek medical, or healthcare services and alternative facilities in the province.
Hmm. And just at the moment, what do we know about the rest of the hospitals in the province? Are they able to deal with the impact of course, people who would have went to Charlotte Maxeke Hospital to seek medical care? Are the hospitals in the area able to absorb the impact of this at this stage?
So our sister hospitals have been quite generous in opening up their doors to the patients that have been coming in. Of course, these patients are also accompanied by staff from Charlotte Maxeke, Johannesburg Academic Hospitals to assist in terms of the care for patients. But of course, this puts a bit of pressure on the specific facilities where we've sent patients. We've effectively sent patients across the entire province, looking at where, the appropriate level of care for various categories of patients where beds would be available. But one of the important things is that, staff have accompanied patients and will be caring for patients at these facilities.
Hmm. And of course, the DA has since blamed the fire on poor maintenance at the hospital. They said that it raises questions. The fire, of course, raises questions about the adequacy of safety measures at this hospital. And they say that this hospital does have a history of poor maintenance. Would you agree with that?
We unfortunately at this stage don't have an official report as to what would be the cause of the fire. I'm not sure where the DA gets that report because, in a sense, then the city of Johannesburg EMS, together with other municipalities, were battling the fire. So I don't think that any investigations as to what could have caused the fire. If it does include poor maintenance, we don't know that. That has to be ascertained to those who are qualified to make that, that statement. I'm not sure where the Democratic Alliance gets that.
Hmm. And at this stage, do we know anything about any deaths or injuries at the moment?
So far, no casualties have been reported either from the fire or from the evacuation operation.
All right. And a final question, of course. Earlier on today, volunteers had been assisting at the hospital. They had been at the scene. At this stage, what is required? Should volunteers still continue to provide their assistance since the hospital has been closed?
So there's a solid system in place, and different resources are required for different things. But there is an interworking relationship between the public and the private sector, where we communicate at a various level, especially around the need for perhaps ambulance service and other related resources. And there is a coordination that takes place at a specific level to also ensure that those who are qualified to do particular work are also then do that particular work. But at this stage, we want to really commend the efforts of particularly the private sector that's come on board and private citizens that have come on board to assist and lend their support during this difficult time, not only for the department but the Charlotte Maxeke team as well and the patients.
All right. Thank you so much for your time.
Yeah, thank you so much for having us on the show.
That was Kwara Kikana, the spokesperson for the Department of Health in Gauteng, of course, speaking to us about the latest with regards to the Charlotte Maxeke Hospital. The hospital has been closed after a fire blazed through the hospital yesterday since last night. And of course, much has been damaged and destroyed at the hospital. Medical supplies and equipment have been destroyed. And at this stage, since the hospital is closed, Gauteng residents have been advised against visiting the hospital during the shutdown and have been advised to visit other hospitals should they seek medical care. Gauteng Premier David Makhura also was at the scene earlier today. He visited the facility to assess the damage. He of course, at this moment, nothing has been ascertained with regards to the a final report with regards to the cause of the fire. And so this is, of course, amidst much speculation. The Democratic Alliance has come out blaming the fire on poor maintenance, and they said that safety measures at the hospital are questionable at this stage, because they say that there is a history of poor maintenance at the hospital. But of course, Kwara Kikana saying no final conclusion has been reached as yet with regards to the cause of the fire. And So yeah, that's the latest with regards to the Charlotte Maxeke Hospital, currently closed. Later on the show, in about an hour's time, we will be joined by Adila Sirkot, of course, Salam Media's very own humanitarian journalist. She will be joining us to speak to us about um, volunteer efforts at the hospital. The public has been assisting in the aftermath of the fire. Of course, earlier this morning, Adila was there on scene, and she will be joining us a little bit later on in the show to discuss this further, and she'll be speaking to us about that. But that's where we're going to have to leave it for this morning, for this evening rather. And when we get back, we still have much to unpack. Please do stay tuned.
From the town one, Ashraful Aid, under the auspices of Are you looking for